Let's talk about the time of menopause in somebody's life. You said somewhere around 50 or 51. There are other changes that go on in menopause that we need to be very aware of. What would those be as far as heart and bone?
Well, for sure, this is a time where a lot of women, when they stop producing estrogen, their bones are going to go through a change. They're going to start to get a little bit thinner because they're losing that estrogen. Every woman is a little bit different too, based on her family history and her medical history. Does she have thyroid problems? Has she been low thyroid? We're concerned about whether or not they're going to lose bone rapidly. If I've got somebody who smokes, that obviously is a risk factor for thinner bones. So those are women I'm going to recommend doing a DEXA or a bone scan on a little bit earlier. But we also know too that women don't settle into their lowest bone mass probably for about 4 to 5 years after they stop having menstrual cycles. So somewhere in that time period after they stop having their menstrual cycles and about 5 years out is when we're really going to be looking to do those bone scans.
So during that period of time, do we think they're losing calcium out of the bones? So do we give those patients calcium?
Well, we want to make sure that they're getting enough calcium in their diet. But there's been a lot of press over calcium. Can you take too much? How do you get it in your body? And we know it's absorbed the best if you can get it through your food. But I don't know about you. I don't eat a ton of food with bones in it anymore. I've got patients now that are making bone broth, and that's got a lot higher calcium in it. But things like your spinach and your broccoli, they've got a lot less calcium in it. You got to eat a lot of it to get the recommended daily allowance, which is about 1,200 milligrams. So I will look at my patient's diet. Are they doing really well with their dairy intake? Do they get good nutrition? And then where are their other sources of calcium? If they're just not getting enough, then I might recommend they supplement.
It's a very important part of women's health. How about cardiovascular? What happens to the heart and the blood vessels at menopause?
Well, we start to catch up to men when it comes to cardiovascular disease risks. So I'm going to look at a woman's exercise routine and what her nutrition is like, what her weight is like, and I'm going to gently encourage, if she doesn't have the greatest health habits, that this is a really important time of prevention so that we can encourage some walking and some weight loss if we need to do that. Also, if she has any symptoms of cardiovascular disease, which for women is a little bit more difficult because they don't have traditional, chest pain that radiates to their shoulder. Sometimes they have things that we consider just like an upset stomach or heartburn. So we definitely want to make sure that we're encouraging them on the signs and symptoms of cardiovascular disease in addition to some habits that are good for them that they can follow up with their primary care doctor if they need to.
Yeah, it's so important because women don't do as well after heart attacks, after menopause, and they don't do as good with heart failure. And so they really are a bigger risk than men are. And sometimes we don't pay as much attention. Is that correct?
I think so. I think sometimes it's just easier to, because they're not classic symptoms, to not always recognize. So you got to have a higher suspicion. I start encouraging my ladies or even doing blood work on them to make sure their cholesterol is okay, checking blood pressures, and then too, just looking to see what their family history is, whether or not they're going to need some cardiovascular prevention.